My name is Kate. I'm a postdoctoral research fellow at the Center for Addiction and Mental Health in Toronto, Canada. This is a very small study. It's a pilot trial, but I was very interested to see that we were actually able to predict short-term outcomes. So we repeated depression severity scores at baseline when we were doing the MRI measures of brain insulin action, and then we repeated these depression severity scales 6 months after these participants did the MRI scans. And what we found was that with individuals who had maybe more impaired or our take on impaired insulin action in the brain, and predicted worse illness severity 6 months after. So they actually had an increased depression severity score at that follow-up assessment. So it's very interesting to see whether this could be a predictive biomarker potentially as well. So very interesting to see if we can reproduce this in a larger trial that recently got funded. This research question came about because we know that there is this bidirectional relationship between metabolic health and mental health. So if we look at individuals with metabolic disorders, they're actually predisposed to developing depression. And then we see a very similar relationship in individuals with depression who have higher rates of metabolic dysfunction. So we're trying to understand if there's this maybe underlying biological mechanism that might be disrupted in both disorders. And that's why we're specifically looking at insulin action in the brain, whether that might be disrupted. And the reason we're looking at that mechanism is because we know insulin action in the brain is related to a lot of processes that have been seen to be disrupted in depression. So things like regulating mood, cognitive function, metabolic function, and that's why we want to dig into it a little bit further in this project. Yeah. I think the fact that these two disorders, and like metabolic dysfunction specifically and depressive disorders, are so interlinked that it's really difficult to look at them separately. We have to kind of take a very holistic approach to it and move away from the more siloed healthcare systems that focus on either one or the other and try to understand both of them together and looking at them, not as separate entities, but as two kind of overlapping mechanisms potentially. And I think looking at a metabolic panel for individuals with psychiatric disorders is very important as well. There's been a lot of research looking at whether higher rates of metabolic dysfunction can predict worse clinical performance or worse illness severity. And I think that could be a good sign or something to dig into further as well. We have seen evidence specifically with metformin and other anti-diabetes drugs and pharmacological interventions that have been repurposed in individuals with psychiatric disorders, and there have been positive findings in terms of improved illness severity and things like that. But I think we do need some more evidence conducted in RCTs where the evidence comes from, I guess, more like from larger cohorts and better designed studies. But that's definitely a very promising field and something that our lab is looking into. Like my supervisors, Dr. Agarwal and Dr. Han, I know our lab is looking at schizophrenia spectrum disorder specifically. So seeing whether this is as effective in other psychiatric diagnoses as well would be very interesting. Yeah. I am working on analyzing some more neuroimaging data from the work that I'm going to be presenting tomorrow. So it's just some more modalities and looking whether our ability to measure insulin action in the brain has been kind of effectively captured through other imaging modalities. Yeah.